that, everybody. The IT is not playing ball today, but as we all know, the best laid plans of mice and men do not always shape up. So thank you very much, everyone, for joining us today. Croeso, welcome, and Prananda, Pawb. Good afternoon, everyone. So my name's Liz Green. I'm a consultant in public health and international health for the Policy and International Health Directorate. We are a WHO World Health Organization collaborating centre, and as part of our work, we work internationally, but also we aim to promote international health activity and partnership working across Wales and the NHS in Wales. I think we would all agree that the last 3.5 years, and even before that, since 2016, with Brexit, has seen the ever increasing importance of international health connections, partnership working, particularly around the pandemic, where we globally tried to address a huge crisis that has affected millions and millions of people's lives. So today we are going to present around some of our work. Our work is, there's a long list here. Laura's put the slide up. So that's myself, Laura Holt, who will be speaking as well in a moment. Laura is a senior global public health officer in Public Health Wales, and she works with me on the International Health Coordination Centre, which was established in 2013 and has a role in facilitating and enabling international health activity and partnership working across the NHS in Wales. There's also Emily Clark, who is a specialist registrar, Abigail Malcolm, Galibe Ezemugo, Daniela Stewart, and Mariana Diakova. So it is a very big collective effort, and it has taken us, I would say, Laura, a good sort of 12 to 18 months to get to the launch where we are. So we're going to talk a bit about that, what the International Health Strategy, its aims and objectives are, why we're doing it, and how you can get involved if you want to. So we're going to jointly do the presentation, Laura and myself. I'm only going to briefly talk about the background and then hand over to Laura's capable hands. So the International Health Strategy, this is the 2023 version, has been identified as an enabling strategy for Public Health Wales's long-term strategy. And that long-term strategy is from now and projects until 2035. So we, bearing in mind all the changes that have happened that I've referred to, like Brexit, like the COVID-19 pandemic, the new ways of working that we have, as most of us probably sat at home now rather than in an office, and probably speak to people more online through this mechanism than we do sometimes have face-to-face contact, but also some of the conflicts that we're seeing now. So there's been significant changes and developments, including the cost of living crisis. So the International Health Strategy, the original one was 2017, and this current new strategy was supposed to be a refresh of it, but I would say it's actually been really a whole new piece of work. And it has been aligned with the long-term strategy, its priorities and its objectives. So next slide, please. Okay, so this is the sort of vision of Public Health Wales's international health, global health offer for the long-term strategy. So We are nationally focused. We are a public health agency for Wales, or the public health agency for Wales, but also globally responsible. So we are outwardly looking as well as internally looking as well. And we want to inspire people that they can connect, they can carry out international health activity and research or partnership working as part of their day-to-day jobs. And I think most of us would imagine international health activity is going somewhere out of Wales internationally. Maybe, you know, there's a focus in Wales on sub-Saharan Africa, for example. But actually, a lot of the work that we do is part of our day job, and we just don't recognise it, and we do it right from where we're sat now. So we're trying to enable and promote a healthier and fairer Wales. We want to connect to the Wellbeing and Future Generations Act, the Wellbeing Goals, the United Nations Sustainable Development Goals, and also try to, you know, learn from each other to try and address some of these worldwide challenges and the goals that we have to better people's lives and the environments that they live in. Next slide, please. So I'm now going to hand over to Laura. Thank you.
Great, thanks for that, Liz. And hi, everybody. So I'm going to talk to you now about, well, firstly about the aims of the strategy and then how we kind of came about and produced it. So what do we want out of all of this? Why are we doing this, and what are our actual aims? Well, as Liz mentioned, we want to maximise those benefits from the international learnings to basically improve the health and well-being of the people of Wales. Secondly, we want to develop globally responsible people and organisations. So this is directly linked to the Wellbeing Future Generations Act, globally responsible goal, and also the SDGs, as Liz mentioned. And finally, we want to respond to global threats and then benefit from those international opportunities and collaborations and partnerships as well. So those are our three aims of what we want out of all of this. So to deliver these aims, we have created 6 enabling international health activities. So firstly, you can see we plan to strengthen partnerships, collaborations and networks, drive best practice and innovation, build globally responsible citizens fulfilling international commitments, as we've mentioned before. We want to create an international health repository and newsletter, provide an international public health community of practice, and finally support international opportunities for funding. Oh, where has that gone? Sorry, has my presentation gone?
It has, but it's back up now. Yes,
back. Okay.
We're not
Great,
doing well on the IT front today.
I know. Don't worry, we're back on. So those are our 6 international health activities. So a lot of this work will be driven forward by the International Health Team and the International Health Coordination Centre, myself and Liz, but also kind of all of Public Health Wales and our partners can also get involved and help us with all of these activities. Okay, so a bit of background on how we refresh the strategy. So our methods and engagement included an extensive mapping exercise of Public Health Wales's international health activity in terms of what different teams are doing, but also their reach geographically. And there was a really interesting piece of work because there's so much international health work being carried out that we didn't know about and other people didn't know about. So there's loads of connections that we can join up. Secondly, we interviewed different directorates, different teams, asking about their global priorities, challenges, and perceived benefits of international health work. We also conducted surveys, and we also commissioned the Tropical Health Education Trust to undertake a scoping review to essentially help us with our data analysis and triangulation. So those were that was our approach to the refresh. So I'll just talk to you quickly about some of the biggest kind of findings from our interviews. So after asking people what they perceived the biggest global challenges were, these were kind of the topics that kept coming up. So obviously we've got health and equity, the climate crisis, migration, antimicrobial resistance came up, pandemics, and also struggling health systems. So it was really highlighted that these were the significant global challenges we're facing, and also how these could have huge impacts on Wales as well. So to continue with our engagement findings, so these are some of the answers from our interview questions of to what people perceived were the benefits of international health. So for example, we've got here, it's more effective when countries work together towards solutions for issues such as climate change. Also, a really good example here is external perspectives on a problem can help us to address our own challenges, so like the ones we have in Wales. So it's really about taking the learning internationally and applying it to Wales. Okay. So we then collected all of the benefits from our interviews and we mapped them against our organisational strategic priorities in Public Health Wales. And you can see here from this diagram how they all interlink with all of the strategic priorities. For example, developing, globally responsible organisations and citizens really links in with our tackling the effects of climate change. So I won't read them all out, but again, supporting sustainable development and implementation of its principles, that links in with supporting sustainable health and care system here. So this shows how much the benefits of the activities for international health underpin everything that we do in our organization and how they can really support those strategic priorities. So as I previously mentioned, we carried out a huge mapping exercise, and this is the product of this. So you can see here how many different, collaborations we have and how far reaching they are geographically. So this really shows that we really need a strategy so that we can have a coherent and a structured strategy towards international health collaborations, because they're already happening across the organization. We just need to really find out what's happening where and who's doing what, so we can really learn from those and get the benefits to our organization and to Wales realized. So I think that's a really, really good kind of demonstration on what we're already doing. Okay, so next I'm going to talk about some international health examples. So if you think about international health, what comes to mind? Probably something that like these photos. So the first photo here is of myself in South Africa carrying out a global citizenship workshop. The middle photo is the work we've carried out in Ukraine. And the final photo is an international learning opportunities placement in Uganda. So I think these are really like typical international health activities of what people think about when they think about global health, and they think about going to another country, doing a workshop, doing work, etc. But actually, as you can see from this slide, a lot of our international health work is actually carried out from people's desks. Liz, I don't know if you want to come in here, because I know this is definitely your area of expertise.
Well, thank you. Some of these examples, you'll see that the one in the middle, for example, I'm also Programme Director for Health Impact Assessment in Public Health Wales, and we've carried out health impact assessments on climate change, on the lockdown, on home working, and actually in terms of that reach that Laura's talking about, they've been used and replicated by other public health institutes, for example, and that's led them to have conversations with me, with the HA support unit team, with colleagues around the organisation. We all have those similar kind of networks that this virtual environment has enabled. So, for example, we've discussed the climate change health impact assessment with the UK government, with Welsh government, with Scottish government, but also as far as New Zealand, where a public health agency there is very interested in carrying out their own climate change health impact assessment at a regional or a more local level. So there's also, these are from the International Health Directorate and Division, but actually we all know of other examples, and Dr. Fumeng will come on and present about his work with the International Association of National Public Health Institutes. And a lot of our work now is done virtually, attending meetings, etc., and learning from each other in that way. Laura?
Great, thanks, Liz. Okay, so how can you support and get involved? Well, you can do as little or as much as you like, really. So you can, for example, just sign up to our mail list and be part of our newsletter or receive our newsletter. Now, this isn't just for Public Health Wales employees. This is for all of our stakeholders across the NHS and anybody else who is interested in international health. You can join our community of practice. Now, this is specifically for international public health, but with this, we're thinking of potentially an annual event, but mostly a network of collaborators where we can share learning. If you're really keen, you can complete our global citizenship training. So this is a free e-learning resource on learning at nhs.wales. It's a really good resource that anybody can access, and I think it really helps to get people thinking more about how Wales and the outside world are connected and how global issues can also affect Wales, and to get us thinking outside of our bubble. So it's really great. The link's on here, so I'll share these slides with you afterwards if you want to get involved in that training. You can do something like you can find an international health link in your directorate or organization, and you can get involved with that, see what's going on there. Or you can even do something as small as kind of looking for, solutions internationally. So if you've got processes that need changing, if you're looking into policy research and practice, you can start thinking about looking into what other countries are doing. I know loads of people already do this, but just starting to think outside again of Wales and outside of the UK even, to look for those solutions abroad. You can bring in loads of learnings into Wales. Another thing you can do is that you can build your own international partnerships. So your team could look to do this if they don't already have any. So we actually have a toolkit to help with building international health partnerships that I can share with you all. It's basically a pack and a how-to guide of how to set up partnerships, or if you're going on an international placement, you can look at how to do that as well. And finally, if you're really keen and you want to go away somewhere, Welsh Government do run funded placements. They do an international learning opportunity or an international grant. So again, you can look at these links in further detail, and you can actually go that extra step and go on one of these learning opportunities. Great. And finally, how will we track progress on our international health strategy? Well, as Liz and I mentioned before, we'll be continuously engaging with this via the International Health Coordination Centre. We will undertake data collection. For example, we will use our engagement findings as a baseline, and look for new international health activity going on. And we also have a monitoring and evaluation plan in place. So that's it from us. Thank you very much. And does anybody have any questions before we go on to the next, before we go on to Meng's presentation?
Thank you, Laura. Thank you very much. I can see we've had one question in the chat.
Great.
Is the International Partnerships Toolkit only relevant for international, or could it be utilised for more local activity, please?
I suppose it could be. It depends on what sort of local activity that you were looking for.
I actually think it could, because of the principles behind it.
Yeah.
So
I think so too, actually. Yeah.
It's never been tested that way, Emma.
No.
But it doesn't mean to say it couldn't be. And I'd be very interested in that.
Yeah.
With you and exploring that. Actually, it could be something for us to think about, Laura.
Yeah, definitely. Yeah,
we're looking at new and innovative methods of what we've got. So yeah, that could be very good. Has anybody else got any questions for us, please? No? We've all gone shy. Okay, well, if you do think of anything, please put them in the chat, and we can answer some more questions at the end. And I'm very pleased to see that Professor Fu Meng Ko has joined us. Thank you so much, Meng, for joining us today and presenting on your work. So just to tell you who Meng is. Meng joined Public Health Wales in 2021, and he has oversight for the delivery of screening, microbiology, health protection services, as well as professional oversight for doctors and public health specialists. So no small job, a massive job, and so I'm very busy, so I know we're very grateful that you've come today. Meng is qualified surgeon and public health specialist, and has worked in a range of roles, including as a CCDC and Health Protection Agency, and he's been director of public health, but also centre director for the East Midlands in Public Health England, before it was transformed into the UK HSA and OHID. And Meng is chair of the final membership examiners for the Faculty of Public Health, and he's got an honorary fellowship with the Birmingham Leadership Institute and an honorary associate professorship with the University of Leicester, which was my alma mater. So thank you, lovely for you to join. But I should importantly say that today you're going to talk about your role within the International Association of National Public Health Institutes. So if you'd like to share your screen and then talk to us, that would be lovely. Thank you.
Oh, diolch, Liz and Pinanda pawb. Good afternoon, everyone. It's such a pleasure to be here. I've just come from a board meeting where we've had a really lively discussion about a whole range of things. So I'm quite excited already, and I'm just delighted to have this opportunity to share with you the work that I've had the privilege to do with IANFI. So I'll just share my slides and just do a check to see whether you can see it. So is that coming through?
Yes, it just needs to be put into slideshow, please.
Yes, I'm just doing that now. Is that now in slideshow?
No.
Oh, I'll select a different window. I think it goes into a different window if I put it on slideshow.
It's okay, Meng. It's a running
it's...
theme today with our IT issues. That's perfect. Thank you.
Brilliant. Okay. So the International Association of National Public Health Institutes is a member organization that comprises at the last count, officially in November last year, 115 members in 98 countries, and it's organized in 4 regions, and more of that detail later. And the mission of IANFI is to really collectively build public health capacity globally and its capabilities by connecting, developing, and strengthening the national public health institutes across the world. And they do this through facilitating collaboration between, a number of institutes or the collective membership, and also to provide resources and technical assistance. And clearly, it's a subscription membership, so countries pay an annual retention fee, and they pay according to their means. So high-income countries will pay much more than low-income countries. And I think that's the spirit of the partnerships that we built across the global community. And it also is an increasingly recognized global entity for public health. So as a collective, it gives a voice to the work of individual and collective institutes for public health. And more importantly as well, it's seen as a key collaborator with the WHO. And I can give you a little bit more information about that work later. The strategic priorities for IANFI are fourfold. One is to strengthen the professional relationships, recognizing that IANFI provides a unique global forum. So if you compare us, say, with WHO, well, WHO is not just about public health. There will be a healthcare delivery as part of its construct. Although it focuses largely on public health, the unique opportunity for IANFI is the public health institutes that are members obviously have a common denominator around ambitions around public health. So I think it really cements the professional relationships between us. The second is to provide the collective expertise of members to develop the public health capacity at a global level. It then also focuses on how we engage, support, and grow the diverse and unified membership base, recognizing that clearly the systems and contexts which all the public health institutes work in will vary greatly between countries. And then lastly is to be a global advocate and at country level for how the public health institutes are key in the public health systems in our own countries. And the overarching priority is that we are able to be agile in our approach. And I'll give a couple of examples of how we, rise to ongoing challenges and how we adapt our focus to meet with the changing technologies that we find ourselves in and the changing priorities that we face. So just moving ahead, we have a governance arrangement with an executive board chaired by Duncan Selby, formerly Chief Executive of Public Health England. He's the president of IANFI, and he's now come up to the end of his first 3-year term and likely to have an extension of that going forward. And then the 4 regions that I mentioned earlier are not what you would expect. Certainly, it was a surprise to me not to see North America in that. But Canada is kind of a member of the Europe network, interestingly, and their director of the association is actually an executive board member. So they play a very critical role. And my understanding is that they have provided significant funding for the work of IANFI as well. Asia is a network, Africa and Latin America. Now, clearly in some of these entities, there are other entities for public health that bring countries together, such as ECDC and the African CDC. These are, cross countries, and some operate at continent level, and some operate through legislative, geographic boundaries, such as the European Union. Now, we work very closely with those regional entities, but there is clearly a need to avoid duplication. So a clear understanding of roles and responsibilities is really helpful in that. At a previous board meeting, it was agreed as part of the priorities for the last financial year to establish a so-called focal point network. And these are the focal points that each member institute can designate as the key point of contact for tactical and operational issues, recognizing that often the directors of public health institutes will not have the bandwidth to really get into the space of the INFI business. So I'm fortunate enough to be the focal point for Public Health Wales, and work very closely with Tracy to make sure that the business of IANFI, the work of IANFI, is known within Public Health Wales, and that when there are calls for assistance or help, that I can coordinate that input. So some people on the call may have had emails from me to say, look, IANFI Europe is doing a webinar on X. Anyone want to join? Or IANFI is putting in the thematic committees, which I've listed 5 of the thematic committees. Some are actually running, and a call for people to contribute to those committees. So here's a plug. If anyone's interested in any of these 5 thematic committees, you're very welcome to put your name forward to contribute. You can do that independently. I'm happy to facilitate that. But if you do, please let me know that you've actually expressed interest to join one of those committees. I've put myself forward for the Pandemic Preparedness, Response and Recovery Committee, which is going to be established shortly. And it's also just to say that the Focal Point Network has agreed some ways of working which really help us understand the links between those with the tactical operational know-hows for each of the member organizations that come together as a network. And I'm one of the 3 co-chairs for the Focal Point Network. And I've agreed to be the link in between the Focal Point Network and the executive board. So the purpose of that is to ensure that there's a 2-way conversation, that the executive board, in driving forward its actions and priorities, has access to the Focal Point Network to operationalize and implement some of those actions. And in return, I think the Focal Point Network can gather thoughts and suggestions to then put up to the executive board. So, I think that conduit works really well. The second co-chair will also join the cross-regional meetings. And these are meetings of the chairs of each of the 4 regions who meet every quarter to discuss commonalities and comparing and contrasting and learn from each other. So Sophie de Bro from Belgium, she's the co-chair who's going to be linking with the cross-regional meetings. And then we've also agreed that the co-chairs will take part in the thematic committees, hence me offering to join the Preparedness, Response and Resilience and Recovery thematic committee. So I think because it's quite new, the Focal Point Networks are still finding its feet in terms of what they focus on. But one of the first things that we did, I'll come on to later to give an example of the work which builds on the work we did in May 2022, where IANFI agreed that we should have a mission to Poland to understand about its immediate phase of response to the crisis in Ukraine and the support it provided to refugees fleeing the country. Poland was the net importer of Ukraine refugees, and at the peak they were seeing hundreds of thousands of people cross the border to Poland, and that set up humanitarian challenges and also challenges around coordination. So we felt that actually it would be useful to kind of learn from their experience. And as Wales was starting to stand up its welcome centres as a national sanctuary, I thought it would be really useful for me to join the mission. As it was only UKHSA, ourselves, and Sweden who were Norway, sorry, who were represented on the trip, and we were, very ably and well hosted by Grzegorz Juszczyk, who is the person on the extreme right, who was the director of the Public Health Institute in Poland. But I mean, we were shown around the various sites. We were taken to the borders, to the areas of refuge, the sanctuary, the welcome centres that they put up, with makeshift beds and facilities to deal with the masses that were coming across. And what we set out to do was to try to identify what the immediate needs were and what solutions were put in place that actually national public health institutes across the world could adopt, and an opportunity to strengthen the coordination between our institutes to support Ukraine, Poland, and affected countries. So we had very clear objectives when we went out for the visit and learning exercise. And what we did was we published it in the peer-reviewed journal as a public health journal open document, which the link is in the presentation. If you're interested, please do click on it to get the article. And on the IANFI website itself, we published a report on the learning we gleaned from it. And one of the kind of really heart-rending experiences was to see pictures drawn by children, up on the walls of the refuge centres. And this one, clearly depicts warfare and clearly depicts some of the contrast between, the adverse impacts of warfare and what people are trying to protect, which is their homes and happy lives. So in many respects, it was a very emotional experience for me personally. But what we learned from Poland was, it is possible. One of the challenges was actually coordinating all the offers of support. So all the NGOs were piling in, but actually there was no existing governance or coordination mechanism to ensure that there was no duplication and that there was organization of all that effort. And another key learning point was, how do you deal with offers of support from professionals? So they had lots of doctors who were offering support, but because they weren't regulated in Poland, there had to be mechanisms to put in emergency legislation for them to be able to contribute. So that was the mission to Poland, and subsequently, when Ukraine Public Health Center were seeking further, more detailed support, they came out to IANFI to ask whether we could, reach out to our members to coordinate this. And this is where the focal point network kicked in. So at the back end of last year and the beginning of this year, following the formal request from the Public Health Center in Ukraine, we collaborated with ECDC and WHO to offer a package of support on their request for guidance development, training and workforce development, and the drafting of public health regulations. And the coordination culminated in a spreadsheet that was essentially sent to Ukraine, detailing what offers of support there were from across the world. And it meant that Ukraine Public Health Center were, inundated with separate proposals for support, coming in different formats. So I think that coordination was probably the first example of how we can successfully organize our efforts through the network. And I trust now that there's a bit more reinvigoration of the network, we can do more of that. I think there was a problem in terms of staffing because the person supporting the Focal Point network left in May, and then since May it's gone really quiet because that facilitation was really important. But now that they've got someone in place, we're hoping to resurrect that Focal Point network and meet again in January to really ask what our direction of travel should be. So the other things that IANFI does as part of its ambition to build capacity and capability is to organize a series of webinars. And if you look at the link that I've put in the slide there, you will see a whole list of webinars. Some are organized at a regional level that may be more relevant to a particular region, but most of them are of global interest. So I would encourage you, if you're interested, to just watch one of those webinars because they're all recorded and you can play them back. And I think shortly after I started becoming involved in IANFI, I was asked to lead a webinar on how to maintain scientific independence during the COVID pandemic. And it was a really interesting discussion. We had two directors talking about their experiences, you know, and I learned so much just by chairing the panel discussion, because it is a difficult balance to strike about how you maintain scientific independence in an organization that's funded by government. And you know, we were hearing all sorts of stories of people facing personal threats to the security. And of course, in the public inquiry in the UK, you'll have heard our DCMO, JVT, fondly known to me, you know, had personal threats to the safety of his family. So these were real issues about the cost of maintaining scientific independence. Anyway, I'm going into quite detail about something that I was directly involved with, and you can't blame me for that. But the other webinars that then were part of the program earlier this year as well, and then most recently, artificial intelligence in public health, was something that Louisa Noland, head of data science in Public Health Wales, contributed to. And that was a really interesting discussion about where AI is going to end up in public health. It's probably not a matter of when, but how. So if you're interested, please do look at those webinars and watch them with interest. So I'm going to finish off just by saying that IANFI is an organization that relies on its members to contribute and be engaged in its work. So there are always opportunities to participate or contribute to the webinars. And we've had examples of, you know, 3 webinars that PHW have contributed to. Liz, you will know that there's been some interest in work on, you know, health and all policies and HIA, which is uniquely placed in legislation in Wales. And I know, Liz, when you presented to the IANFI annual meeting in Lisbon, it was really well received. So, you know, seeing that connection made as a result of that is a testament that this mechanism works to bring to the attention to the world areas that we're really proud of that can have an impact on population well-being. And then the other areas I mentioned before, the thematic committees, and then specific projects and areas of work. The public health emergency workforce is a formal arrangement between the WHO and IANFI, and they're starting to look at the global health core as a consequence, and Public Health Wales will be engaged in some of that work going forward. There was recently an integrated disease surveillance project. We provided some information and feedback, and that's now culminated in a discussion and report. So And there's always the opportunity for new developments to be proposed, and we can take it through the National Focal Point Network, and I'm happy to do it on behalf of Public Health Wales. So my contact details are there on the slide, and if you are interested or you have any questions about INFE, I'm very, very happy to have a discussion with you. So please do contact me. And I'll stop there. Thanks, Liz.
That was amazing. Thank you so much, Meng. That was super, super interesting. If anybody's got any questions, then please put them in the chat. But we do have one already, well, two really, for you, Meng. So the first one is, are there any countries that are particularly progressive, innovative, or exciting in their thinking for Wales to learn from?
Oh, that's a really, really good question. And I think Norway potentially, who's been chairing some of the webinars. So the regional chair is in Norway, and their institute has a lot of fingers in a lot of pies, and I think there are some areas of work we could build on, because they did a seminar which actually they were interested in themselves, which was about how do you make sense of science in the pandemic when you were putting in place non-pharmaceutical interventions and social measures and the science behind that. That webinar was really, really incredible, because it was talking about the Danish experience about going out and doing a comparative trial of wearing face masks, and the flack that they got when they published the findings to say actually it probably didn't make a lot of difference, was quite controversial at the time. So I think Norway has an ethos about them that they're not afraid to go into areas of controversy. Now, I don't know enough about the other institutes to comment on whether, there are exemplars, but one of the things that we're doing as the Focal Point Network is to build a profile for each of the members.
Yeah.
And the profile will be able to highlight. So if I'm reading the question correctly, then it may be that if we had that profile available, then people can search through it and say, oh, I'm interested in health promotion. Where shall I go for an exemplar? And it might be, Tallinn, it might be Estonia.
That's really interesting. It's a bit like the mapping that we did for international health activity and where it reaches and what its focus is in Public Health Wales, which we know was a massive task, but to do that at a global level.
Yeah. So, to be able to say to the world, if they don't know it already, that we're leading edge on HIA, we're leading edge on ACEs, and all those things, I think is a great tool for connecting people.
That's fantastic. Yeah. And the other part of the question is how Keris was wondering how Wales is viewed globally. So Wales, I suppose.
Wales is right up there. I'm so proud of being in Public Health Wales. I can't tell you how proud I am. But Wales is talked about. People reach out to us. People know about the work that we do. So Mark Bellis came out to the European meeting last year in Stockholm. No, not Stockholm, in Tallinn. And he talked about global violence and impact, and it was so well received. And Mark's a really good speaker, and his slides were really, really powerful, and people remember that, and people talk about it. So I think Wales is right up there.
I think you're right. We have our core things that we're known for, and so people, even if they don't formally know, they might informally know through those connections. And I think IAMFE, I was very interested in what you were saying about how it's coordinated some of those efforts and challenges around the Ukraine war, so that Poland could benefit and other people could benefit from that. So that was marvelous. I don't think we've got any other questions, but from if you don't mind, my chair's prerogative. I was thinking about, you know, some of the challenges that the international health partnership working and activity can sort of bring, in terms of people think that it's not part of their job, or it's another thing to do on top of their job. And I think we show that we can sort of try and manage that quite well. But do you find it, you're like me, I think you love doing it, but it can also be another thing, or do you not feel it's like that? You might say, well, I never feel like that, Liz, I don't know.
So Liz, you know, my motto is variety is the spice of life. I think without variety, I wouldn't exist. I wouldn't be me. That's just the way I'm built. So I do look for opportunities. And when I saw, so my story with IANFI goes back to 2018, when I went to Johannesburg, sponsored by Public Health England, to be trained up as a stage development tool facilitator. And guess who I met there but Andrew Jones, who is currently my deputy. And Andrew and I plotted to do something together as trained facilitators. So he invited me into Public Health Wales in December 2019. And we did an SDT session with my current team, actually. And then, you know, that gave me a glimpse into the organization, and I was really struck then. And the purpose of saying that is you just never know what those paths will lead to. For me, it actually led to this job, actually, because had I not gone to South Africa, I wouldn't have met Andrew. Had I not met Andrew, I wouldn't have been doing the co-facilitation. Had I not come to Public Health Wales, I wouldn't have had that kind of really positive experience right from the outset. So I think sometimes if you don't take the opportunities, you never experience the full breadth of the future.
Yeah, I wholeheartedly agree. Agree. So.
But what I would say is it has to be proportionate.
Yeah,
and it has to add value to people in Wales. So for me, the mission to Poland was going to add value because we were setting up the welcome centres. So coming back with the messages to then feed into the people who are leading on the development of welcome centres. I think more could have been done. Yeah, but we shared the learning and we shared it in Wales for the benefit of people in Wales looking after people from Ukraine.
Fantastic. So somebody's asked about how can I become a member of IANFI? Is it just Public Health Institutes, or can we just...
Is that question from someone in Public Health Wales? Looks like it.
Yes, it's the institute, isn't it, that's a member?
Yeah. So the Public Health Wales is a member. So by default, Selena, you are a member too. And, you know, if you're interested, you know, come and have a chat with me and experience IANFI, because, you know, I'm sure depending on what your skill set and experience is, we could make use of that input. So if you're interested, please let me know.
Fantastic. Thank you. Well, we've run out of time. So on that positive note, thank you so much, Meng, for coming. It was super interesting, really was.
My pleasure.
And thank you to everybody for attending today. Diolch yn fawr iawn. There is an evaluation of the session and the link's been put in the chat. We will make the slides available to everyone. And if you do want to engage or talk more through these things, then please do come to myself, to Laura, if you want to know more about Meng and his work, or ask. I'm sure you're very happy to talk to people, Meng, as you've said. So thank you. So diolch yn fawr iawn. So thank you very much. And we will say goodbye for now. So hwyl fawr. Goodbye.
Hwyl fawr.
Thanks, everyone. Bye.